CDC Director Dr. Rochelle Walensky joins us now. Good morning to you, Dr. Walensky. It's good to see you.
Good morning, Gayle. Thanks for having me.
So here we go. The Biden administration is calling June the month of action. You know, June is normally weddings, graduations, Father's Day, but now month of action. They're saying, people get your vaccine. And we just heard in Weisha's piece all the incentives that are being offered. Anything from donuts, which, by the way, I did claim, guns, alcohol, sports tickets, free daycare. What do you think of all these incentives, number one? And number two, do you think they're working?
You know, June is going to be the month of weddings and the month of vaccination. So I'm really excited for the month of campaigning for vaccination ahead. And, you know, I think we need to understand that people may have not gotten vaccinated to date for various reasons. It may not have been easy. It may not have been convenient. They may not have had the incentive that they wanted or needed. Or they may have questions about the science and how quickly we were able to get 3 safe and effective vaccines. So really what this month is going to be about is meeting people where they are, understanding what they need in order to get vaccinated, the information that they need, the resources that they need, the access that they need.
Well, they're certainly they're making it easy and certainly giving access. We keep hearing that we need to reach 70%. Why is the 70% number so effective, so important, rather, important?
You know, we want to get the majority of America vaccinated, and after we get to 70%, my goal is going to be to get to 80%. I think what we really understand is that this virus is an opportunist, and it will go to places where people are not vaccinated. And so you are safe if you are vaccinated. You are not safe if you are not vaccinated, and my job is to keep America safe. So we will work to get to 70% on June 4th, and then we will continue to work to get beyond that.
I like the part where you're saying you're safe if you are vaccinated, because just so you know, all of us sitting at the table are vaccinated. A lot of people are starting to go back to work, and some of your coworkers will not be vaccinated. How concerned should we be? I got in a cab the other day. The driver wasn't vaccinated. It made me very nervous. Go to a movie theater. You're sitting with people, they're not vaccinated. How should we handle this? How worried should we be? I know that it's not safe for them as it is for us, but what about us who are vaccinated, being around those people?
So for those of us who are vaccinated, we have seen in study after study now, not just the clinical trials, but in the real world settings, that these vaccines are protecting more than 90 to 95% of people from getting any disease at all. They're even better at protecting against severe disease and hospitalization. So for the most part, nothing's 100% foolproof, but for the most part, if you are vaccinated and you don't have an immunosuppressing disease, for example, you really are safe from potential disease around you. We've also seen that these vaccines are working against the variants that are circulating here, and that's a really important component as well.
Should companies require their employees who are coming back to work be vaccinated?
You know, I think that that's going to have to be at the individual company level. Certainly there may be some places where companies feel like that would be the best way to go, that people would be safer, that people would feel safer coming back into the workplace. So that we're going to leave at the company level.
And I'm almost embarrassed to ask you this, but on TikTok, there's a video going around right now. Have you seen it? And somebody did it to me. You put the coin on your arm. If it stays there, it means that there's a chip in your arm. It's a big thing that's going on TikTok right now. Can you just put that to rest and say how ridiculous it is? That we are not being injected with chips. Is what I want.
We are not being injected with chips. What we're being injected with is this incredible scientific breakthrough that keeps us safe and is effective against something that has killed hundreds of thousands of Americans over the last 15 months.
What concerns you now as we sit here today, this third day of June? I know you want us to get vaccinated, but other than that, what are you worried about?
I am worried about what's happening around the world. I'm worried about variants, if we have continued circulating virus. I'm worried that there will be people who don't believe that this vaccine will protect them and that we are relying on each and every individual to step up.
All right, Dr. Walensky, we thank you. We saw you throwing out the ball the other day. On a scale of 1 to 10, what would you give yourself?
I'm going for like an 8.
Okay, fair enough. Thank you so much for your time. Thank you.
Thank you.
Bye.